when we're rehabilitating the upper extremity, the shoulder, or we've got neck pain or upper back pain, we're always going to work the posterior rotator cuff. The rotator cuff is 4 muscles. They wrap around the shoulder, and the bicipital tendon is another tendon that's added to that. They can all get injured. When the inflammation starts to come down, we're usually able to start exercising so we can reset and muscularly retrain the muscles in the shoulder girdle so that we don't get as much pain and dysfunction, and we just don't have to waste energy on that stuff. So we're going to go through a couple of exercises that is very germane to supporting your progress in the upper extremity, the upper back, and the neck. And first of all, we're going to remember our posture. We're going to keep the ear over the shoulder over the hip. We're going to keep a slight chin tuck, because that's going to reinforce good neck mechanics. And we're going to try and pack this shoulder blade in, bring it in a little bit so it's not winging out here, winging shoulders all the way out here. We want to fire these muscles and bring it in like that, lock it down, and then we're going to do some extension exercises where the arm is going to lock out and we're just going to move straight back. And let's do some extensions. Go ahead. And this is working the medial triceps, which is going to pull the shoulder back and take a lot of stress off the front, a lot of stress off the neck, and a lot of stress off through here. Again, if you get any pain or discomfort, you're not quite ready for the exercise. We've got to wait until we've taken the inflammation down enough to do that. The second exercise we're going to do is an external rotation. So let's go ahead and face the camera. And we're going to start with the same posture, a chin tuck, ear over shoulder, shoulder over hip. We're going to take it from tension here, and we're going to come right out to here. Go ahead. And back again. And again, we're packing the shoulder blade down before we even move. So this is nice and stable. We're not going too far out to the side because we don't want to do that. We don't want to put too much stress. As soon as this arm comes past 90 degrees there and comes out here, we're getting more stress through there. We just want to keep it focused on working these muscles in the back. And it's going to do 2 things. It's going to rotate the head round this way so we get less inflammation and pinching in the shoulder. And the other thing is, as these get stronger, they're going to start pull the head down a little bit so we have more space through here so we can get our arm up further after injury. The final exercise with the bands is we're going to be going across the other way. This usually comes later when there's less inflammation and we're looking to strengthen the front of the capsule here. And what Makino's going to do, she's actually going to go to tension here, and she's going to come across this way. And this is a later exercise that we do when the inflammation is coming down to strengthen some of the anterior portion, the front portion of the shoulder. We would not do this in the initial exercises for the shoulder because it's too inflamed. We need to get the mechanics working a little better before we go to this exercise. But this is an internal rotation exercise for the shoulder. And we've got a chin tuck, ear over shoulder, shoulder over head.